Hello. Here I am, the one who's going, why haven't we started? And I'm supposed to start this session. So it truly is a pleasure that we're all here and that we have an amazing group of people here during this session where this is not research. Some of it may relate to research, but some not. But I think with this panel of speakers today, you will be really thrilled with what we're talking about. So I have the pleasure of introducing our moderator, Dr. David Assis, who has been working with us for many, many years. He is from Yale, New Haven. Did I get the right spot there? And he has worked with us. He is on our SMAC committee for many, many years, is a staunch supporter of patient-reported outcomes, which is something all near and dear to our hearts, and has just been a very active member of PSC Partners, and we thank him so much.
Thanks so much. Thank you so much, Joanne, and for everyone for attending. It's really beautiful to see the 20th anniversary of this meeting, and the organization is phenomenal. We'll jump right in then to our session devoted to new approaches to improving care. I'd like to start by bringing up to the podium Mary Vyas, who is a parent of a PSC patient who was diagnosed as a teen, and as we all know and love, is the president of PSC Partners Canada. Thank you so much, Mary.
Thank you so much. Good morning. I've been asked to share this story with you. Just a few months ago, I celebrated a milestone birthday. I spent the afternoon with the younger of our two young adults, making my very favorite cake together. I love cake, especially tart lemon cake with tart lemon cream cheese frosting. The more tart, the better. As we sat down that evening to enjoy my birthday cake, Dev, my kiddo, says, Mom, have you looked in the mirror? Which started a chain of events that led to me checking in with the on-call medical team, a trip to the ER, and then a long wait for an on-call specialist. Not exactly how I would have envisioned spending my 60th milestone birthday. It is totally unimportant what was going on with me physically. It turned out to be nothing. And the reason I'm telling you this story is because aside from cutting my cake short, I didn't mind in the slightest spending my birthday in the hospital. See, a few months earlier, I had had surgery when our son was diagnosed with PSC over 10 years ago, and I learned about living organ liver donation. I grasped at the thought that I very literally might have it in me to fix this problem. It didn't take too long to learn that the fix for PSC is not that simple. But I also learned that I had until I hit 60 to be a donor, at least in Toronto. After that, I or my liver would be considered too old. While I've been ready for 10 years now to jump at the opportunity to offer a piece of my liver to my son, his original liver is still hanging in there, for which we are very grateful. But as the expiration date on my liver approached, I realized that if I couldn't give this gift to him, I also couldn't pass up the opportunity to give this chance for health to another person. So when I submitted my application to be a living liver donor, I checked the box that said I would be what they call a non-directed donor. Let the transplant team decide who needed the donation the most. And then after a few tests and in honor of my milestone 60th birthday, I did not have a big party or go on a trip, but even better, coinciding with that expiration date, I woke up super early and with a calm excitement, I joined a queue of others checking into the surgery at the hospital, had an IV put in, I wait around on a gurney in a pre-surgery curtain area with my husband Jay. A man comes in and says, "We gotta go now." And then, just like in a TV show, go on a gurney sprint to the operating room. Doors banging, bright lights. In the OR, things feel calm and orderly again. I hear and watch the team doing their prep and checklist. And I'm just feeling so thrilled and relieved that I'm able to have this surgery to donate part of my liver to somebody who needs it. Amazingly, it will grow back in 3 months. The next thing I know, I'm waking up and I am just so overjoyed and amazed. Jay takes a video of me, and I'm in no pain, and I'm really very happy and amazed by this process. And just like Jessica in the video we saw yesterday, I kept saying the word amazing over and over. I may have been a little loopy. I do not know who received 2/3 of my liver. And yes, it is bittersweet that it is not my son. Of course, I wish I could fix PSC for him. But I do know that I am physically totally fine. I have a very nice scar, and I had a few months of recovery while my liver regrew, taking a break from the PSC work. Mostly, I had a lot of sleep and staring out the window. And as I look forward to celebrating future birthdays, I also look forward to lemon cake with no ER visits, and the thought that maybe there will be somebody out there who, when picking something sweet and special to celebrate their liverversary, the anniversary of their transplant, they might just have a craving for their new favorite, very tart lemon cake. Thank you.
Thank you so much, Mary, for that story. It's going to be hard to move on in any direction after that. And as a clinician who takes care of patients who occasionally receive non-directed donation, it is unspecial. Thank you so much. We're going to proceed with our next talk from Sara Kohut, who is a psychologist, a health clinician scientist at the Inflammatory Bowel Disease Center at the Hospital for Sick Children, and assistant professor at the University of Toronto. Her research develops therapies and programs to support the quality of life of children with chronic health conditions and their families. She'll be speaking about promoting resilience while living with PSC. Sara, thank you.
So, just the green?
Yeah.
Okay. If we can get my slides up. Thank you, everyone, for being here. What a tough act to follow. And at the same time, and I've said this so many times over the last couple days, that as someone who studies peer support and thinks that really we need our people, this is literally it. It doesn't get better than this, I don't think, to be able to spend a weekend with folks who truly get it. So thank you very much for being here and for choosing to take the time to come listen. I always like to start almost all of my talks with this point. It's that really and truly our brains are wired to survive and socialize. And honestly, that means that happiness is not our default. Safety is. So if for some reason you're struggling or you're not happy, that doesn't mean that you're doing something wrong. It might just be hard because it's hard. And in moments of struggle, thinking about what you can do to get yourself to that place of safety and also connection. I think living with PSC, it really puts you at risk for being more socially isolated. And again, I say this so that people can recognize, let's really think about what can we do to feel as safe as we can and to be as connected as we can. And here's the other thing about people. Humans, we like to know. We like to think we know. We all want to pretend we know what's going to happen next, what's going to happen tomorrow. It's part of who we are. We also love to tell stories and make meaning. It's a beautiful part of being human. And I also know that a diagnosis of PSC will be kind of like it's like running into a brick wall where you know that you don't actually know what's going to happen next. And maybe that's okay, and maybe we can take a little bit of time and think about how do we want to show up in the face of this? What do we want our life to stand for? Because certainly, as a psychologist, people will talk about things like how do you distract yourself? Can we list the things that we are certain of? Can we think about how to problem solve? But what happens when it's still hard after all of that? And I just have a question. I want to think about how much energy goes into kind of fighting against whether it's the anxiety or the uncertainty or the diagnosis, or how much effort really goes into getting that perfect diet, perfect workout, perfect, and doing everything just right. The question is, would there be a certain percentage of your energy that you could shift away from trying to control everything and maybe thinking about, like, what is your why? Why are we rallying? What are we doing this for? What do we want to stand for in the face of these challenges? Because I just don't buy that we can ever really fully get rid of all the stuff we don't want. So can we strike this balance of moving towards the life that we want to live while acknowledging that we're carrying a heavy load? So in other words, let's redefine success here. What if success is beyond the absence of pathology and it's also about the presence of something you love? And ultimately, for me, that's about the goal shifting away from getting rid of everything we don't want and also moving towards the stuff we do want. And I'm not trying to say that this is easy. I think it sounds so simple, kind of flowing out of my mouth. I think that it just makes it worth it. This isn't about not being afraid. It's about being afraid and showing up anyway because it matters to you. So I think about, how do you actually do this, and what are some of the ways that you can think about implementing this in your everyday lives already? One is there anything that you would be doing differently if you weren't worried about PSC, worrying about symptoms, worrying about would you be doing something differently? And what would that thing be, right? Or perhaps, how do you want to show up in the face of adversity, in the face of all these challenges and uncertainty? Maybe it could be a quality. I often like to use qualities, whether it's bravery, it could be creativity, it could be curiosity, it could be kindness, it could be whatever is meaningful to you. Getting to work with young people, sometimes they find it a lot easier to choose a spirit animal or even a fictional character. Deadpool seems to be a really popular one. People want to show up as Deadpool to just about everything. But I think the point here is it's about how did you show up, and success is how you showed up, not necessarily the outcome. Because over a lifetime of showing up in a way that's consistent with who you want to be, that's what a meaningful life is about. And what are those small steps that you could be taking to move towards that life? And again, I say this before, I'll say it again, it all sounds simple, like flowing out of my mouth. It doesn't mean that it's easy, it just means that it's going to be worth it. Because this is not fair. It's absolutely not fair. And I think that there are going to be moments where you feel stuck and you're struggling. And can we get to that place of and both? This is hard, and also I can choose how to show up. And can we also offer ourselves just a little bit of grace? Really and truly, I want you to think about this as grief, right? This is not something that you have to get over or you have to fix or you have to control. It's something that you walk alongside with. And there's this poem that I really, really love by Larry Yang, and the reason why I love it is because it's more of a framework or a guide or a direction. And if you follow from this, it just allows you to make mistakes. We're all human. That's how we figure out balance. We go a little bit too far to the right, too far to the left, and we figure out what works for us. I want to get rid of this idea of good, bad, right, wrong, and I want to come back to workable. What is workable for you right now in this context today? I think that's what will help move forward. So I will read the poem. If you think about being in a situation, just try to see if you can hold this close to your heart. May I be as loving in this moment as possible. If I cannot be loving in this moment, may I be kind. And if I cannot be kind, may I be non-judgmental. If I cannot be non-judgmental, may I not cause harm. And if I cannot not cause harm, may I cause the least amount of harm possible. And I think about this poem in terms of how you treat yourself as well. Can we offer ourselves a little bit more grace? Because this is just hard. And also, there's already resilience in everyone here. You've been able to get yourself here, and I think there's these moments where we can actually connect with what is actually going right. Things can be really difficult and things can be stuck, and I think we can all think of a time where we've cried and laughed at the same time. It's not a silver lining situation, it's an and both. Can we ever allow ourselves to sit in that space? I also think we're losing our capacity to rest. I don't know when being busy became the marker for success. I think that really at the end of the day, we're human beings, not human doings. And I really want to encourage everyone to really think about allowing yourself true rest. If you are in the shower, enjoy the shower. You don't have to be in that first meeting. You don't have to be your to-do list, your emails. It's about pausing for a second and stepping out of that habit of rushing and just getting to the next thing and getting to the next thing. Because when we're just trying to get to the next thing, we're not actually enjoying the here and the now, and we're missing the delicious parts of our lives. And I do genuinely believe that some of those values, those things that are really meaningful to us, can be just a whisper. So if we don't pause long enough, we're not going to hear the whisper. We're just going to hear how loud anxiety and stress is. And that's, again, part of going back to how our brains are wired. We're going to naturally notice the stuff that's scary, the stuff that's stressful. That's why news tends to be sensational, because they want to get people's attention. So I really want to think about what are some of those implications for your life if you actually allow yourself to slow down for a moment. For me, coffee is like joy. It's like I am drinking a cup of sunshine. It is the best part of my day in many days. And I will just pause and allow myself to enjoy some of those first sips of my coffee. Or maybe it's over lunch. I use this example often because working in a hospital, things are really go, go, go. You don't have a lot of time. So it might be me setting an alarm for 3 minutes and just eating. Literally just enjoying my lunch. It's also, when that timer goes off, it's also allowing myself the grace of shoveling the rest of my meal in my mouth and moving forward and not feeling guilty, right? Or maybe it's walking from one meeting to the next without being on my phone and just walking. It sounds so radical. Like, just literally allow yourself to walk. And don't get me wrong, I am a mindfulness buff, and I think the idea of meditation is wonderful. It does many wonderful things to the structure and function of your brain. I also know it's really hard for people to dedicate that time. So what about, instead of, in those moments where you can't maybe dedicate time to meditation, can you level up what you're already doing? If you're brushing your teeth, just brush your teeth. We don't need to be on our phones while we brush our teeth or to be thinking about what we're gonna wear or what we're gonna do next. Actually just enjoy brushing your teeth and maybe clue into whether the toothpaste actually tastes any good. Oh, how do I go back? Oh. There. You got a little spoiler. And again, I do bring this up because often I think working with folks and getting to work with folks who have PSC or who have IBD PSC, there is a lot of perfectionism. And I think there's this feeling that if you just get everything right, then you can prevent anything bad from happening or a flare or disease progression. And I really want to invite the energy of progress and permission instead of perfection, because it is absolutely okay to take a sick day. It's also okay to take care of yourself. Not only for the folks who are living here with PSC, but the folks who get to love them as well. And I will say this, when I have someone in my life who's struggling and they ask for help, it is an absolute get to do. It's like I won an award because I know how hard it is for people to ask for help. You are not a burden. Genuinely, the people who care about you want to show up for you, right? I genuinely think that for them, it's this thing that they get to do. It's like they somehow got in, because being vulnerable is really hard for folks. And I said it before, I'll say it again, being busy is not equating success. I don't know when we came up with that. And like, this is hard, and I said it before, I'll say it again, this is hard because it's hard. It's not hard because you're doing something wrong. So can we just acknowledge it's hard? You're not alone in hard. There's a room full of folks here walking this path with you. And is there something you can do to care for yourself because it's hard? Not even to get rid of hard, just genuinely because you're going through something difficult. I also think that boundaries are really hard for a lot of folks, just across the board. And to me, self-compassion actually is about boundaries, and it is about being fierce, and it's about knowing what your lines are and where you want to draw those lines. So I know that as much as people say like no is a complete sentence, and it certainly is, I know that it can be hard to set these boundaries, but really thinking about what actually is going to help you in the long run and how do you want to show up. Because you are absolutely allowed to build the life that you want and the life that works for you. Especially today, in today's day and age, it's not necessarily everybody needs to work a Monday to Friday, 9 to 5, or everybody needs to have 2.5 kids and a dog. And like, you can create whatever life makes sense for you and whatever life is workable for you. Again, we're getting away from right, wrong, good, bad. It's what's workable for you and your family. And here's the thing. I actually do not believe in laziness. I think that people use lazy when they are being self-critical and they're going through something difficult. So what I really want to encourage everyone to consider is the opposite. Have you actually been lazy enough? Have you allowed yourself the space, the time, the quiet to hear those whispers of what matters to you and how you want to show up in the world? Thank you again, everyone, for taking the time to be here. Like I said, as someone who researches peer support in chronic diseases, this is like the stuff of dreams, to be in a room with this many people who get it. So thank you again, everyone, and we'll leave it at that.
Thank you so much, Sara. That was truly inspirational. I think it's something that we all need to hear and take to heart. Incidentally, Sara, I should have you invited to our next faculty retreat at Yale. I think there's a lot of weirdos there who could use that as well. So thank you very much. Okay. We'll move on to Emily Johnson, who will be speaking about Empower, a 12-week online wellness program. Emily is a PhD candidate and first-year medical student at the University of Alberta, where she completed her Master's of Science degree in medicine. With a passion for patient-oriented research and a commitment to improving health outcomes, Emily's doctoral project will focus on Empower, which she'll be describing to us today. Thank you so much.
All right, thank you everyone so much for having me in sunny Phoenix. It's already way better than Edmonton, so thank you so much. All right, so today I'm going to be talking to you about Empower. So Empower is a 12-week online mind-body wellness program that our research team has developed, and we've developed it for a range of chronic conditions, but for today we'll focus on the PSC and the post-transplant version of this program. These are our disclosures, notably Dr. Panita Tannen, who's not here today. She is my supervisor, and she received funding to support this work, and she's the brains behind this operation, and she's also self-proclaimed obsessed with wellness, and you'll see that throughout this presentation. All right, so we've got a few minutes together, so I'm going to start off by talking about these concepts of mental and physical well-being and how interventions to promote these well-being are important in this holistic approach to care in people living with PSC and those who are post-transplant. And then I'll talk about our Empower program, which is that 12-week online mind-body wellness program, and I'll share a little bit about the components in that program and where we're at with that research study. All right, so this is not surprising to anyone in the room, but we know that living with a chronic health condition, especially something like PSC, can bring a big burden, especially related to mental health symptoms. We also know symptoms like fatigue are quite prevalent in people living with PSC, and these things can all come together to impact your health and mental health related quality of life. And a lot of qualitative work has gone in to try to describe this experience or aspects of this experience of living with PSC. And people have talked about how there's kind of this separation between the medical care that you receive and then the mental health focus of living with a chronic illness. Others have talked about the invisibility of PSC at times, where you appear okay on the outside, but there's a lot going on internally. And then others have talked about this mourning of kind of a previous life or this new life that you have with the diagnosis of PSC. And there was this really excellent qualitative study done very recently where they tried to describe aspects of living with PSC, and they described it as this wave-like experience where you're kind of oscillating between the invisibility of the illness and then the ever-presence of it in your daily life. You're embracing this new life, but there's this threat of progression or transplantation, and then you're feeling in control one day, but then there's these constraints, especially related to fatigue, where you find yourself having to hold off on doing certain things because of the symptoms that you live with. Does that kind of resonate with anyone in the room, this kind of wave oscillatory experience? Yeah. And so our research lab has been really interested in trying to develop interventions that can support you as you kind of move through these oscillations. And something we're interested in is something called mind-body wellness programs. And particularly, we're interested in moving these to be online mind-body programs for several reasons. We think everyone has a smart device at this point. So you're able to access these programs and these techniques from the comfort of your home. They're relatively affordable. You don't have to leave home. And you can also reach people who live rurally or remotely who would otherwise have to travel for this type of programming. And so we did a systematic review, which essentially we just looked at a whole bunch of studies and wanted to know what the impact of these online mind-body programs is on mental health symptoms. And this is an unfortunate image, but it just gets at the fact that we had 56 studies that we included with over 7,600 people, and we saw significant reductions in anxiety and depression symptoms for those who had access to these types of programs. And there's this effect size thing that we report. It was a small to moderate effect size, but it's actually quite remarkably similar to some of the studies that you'll see reporting outcomes for pharmacotherapy or medication for anxiety and depression symptoms. And so what is mind-body wellness? There's a range of definitions out there. For our research team, we describe them as health practices that look at connecting the brain, the mind, and behavior, and how that can impact health. And it can include things like mindful movement, meditation, breathing, more psychotherapeutic approaches like cognitive behavioral therapy or acceptance and commitment therapy, and some education as well. So this is a lovely pug. And Dr. Tannen likes to describe these techniques as an integration between the best of the East and the best of the West, where West is maybe that more traditional medical approach that you receive at your physician with medications or monitoring of your lab work. And these Eastern techniques are things like meditation, breathing, or psychotherapeutic approaches that you can integrate in your daily life to help with that whole body or whole person approach to care. And there's been a lot of research actually looking at these more Eastern techniques like meditation and breathwork and yoga and how those can impact mental health symptoms or outcomes in people living with chronic illnesses. These are examples of just some of the studies that have looked at Qigong or Tai Chi, mindfulness meditation, mind-body exercise, so things like chair exercise or yoga, as well as breathwork techniques in people living with asthma, for example. And there's a range of techniques that we've included in our journey with these development of mind-body wellness programs. So we include overtly mind-body wellness techniques, like the ones mentioned here, with meditation, breathing, and movement. We've also included some psychological programming, which I'll describe later, but it's all based in acceptance and commitment therapy, and each week of our program has a theme surrounding that content. We've also got education. This is kind of the differentiating factor between our programs. So these are unique to PSC and post-transplant. And then lastly, we've got community support, and we've done our best to try to facilitate community support in an online environment, which I'll share with you how we did that. So movement is an integral part of our program. It's an integral piece of mind-body wellness programming, and it can include a range of techniques. We've focused on yoga, so there's yoga with floor or standing poses, Tai Chi, and then also chair exercises, which can be lower or higher intensity. And I think everyone knows, we know exercise is good for us, physically and mentally as well. But this is an excellent study, a very big study that looked at, it's a systematic review of systematic reviews. So the previous study I showed you was just one systematic review. So this was massive. They had 97 reviews in it and over 128,000 people. And what they found that was any type of movement, whether that was strength training, aerobic, or simply mind-body chair movements or yoga, had a positive impact on mental health symptoms. And this was regardless of age group as well. So it was across the board beneficial on mental health symptoms. So breathwork is a core component of our program, and it's a really simple technique that you can use to manage stress. If you take anything away, there's these techniques of breathwork that can be really helpful if you're dealing with stress on a daily basis. And the best thing about breathwork is it activates something called our parasympathetic nervous system. So if you think the sympathetic system is for your flight or flight, the parasympathetic is the opposite of that. So it's going to put the brakes, it's going to help reduce stress. And there's a couple of different breathwork techniques in our program. One of the simplest is belly breathing. So you may find yourself, a lot of us tend to breathe with our chests. And actually belly breathing, where you put your hand on your belly and make sure you're actually moving your belly to breathe, is very helpful in reducing stress. And it's because it activates this thing called the vagus nerve, which moves down and through your diaphragm. And that's very helpful for activating that parasympathetic system. Another simple breathwork technique you can do is sighs. So this is simply just breathing out longer than you breathe in. Some people prefer to do it audibly, so that's like Darth Vader or like blowing breath on a mirror, those sorts of techniques. And integrating that with the belly breathing is actually a very practical and easy solution to try to manage stress in the moment. I know I was doing it when I was sitting down there. And this is a review looking at the impact of these breathwork techniques on mental health outcomes. And again, it's a smaller study. They only had 12 trials. But they found that any type of breathwork had an impact on stress and mental health symptoms. And we're actually working to update this literature to see if specific breathwork techniques have more of an impact than other ones. So we're really excited to share that with you later. Another technique we've included in our program is meditation. So we've heard about meditation, how beneficial it can be. One study looked at people who'd never meditated before and gave them meditation programs for 2 weeks and found that they had improved memory and focus just within 2 weeks, so it can be quite fast acting. The other great thing about meditation is it's been shown to actually change your brain. So we call those neuroplastic changes or connections in the brain that can change. Namely, it improves the prefrontal cortex volume, which does many different things, but importantly for attention and working memory. And then it's also been shown to reduce the volume of your amygdala, which is your fear center, so a very important center in your brain. But if it's too large, that can be hard to deal with when you're going through stressful situations. So meditation was found to also change that size. So all of these things can come together to actually improve that emotional regulation. Another piece of our program is something called acceptance and commitment therapy. You may or may not have heard of it. It's similar to cognitive behavioral therapy, but it differs in that cognitive aspect. So ACT doesn't try to change your thoughts, but it gives you tools to try to cope with those thoughts that you're experiencing and help you navigate with psychological flexibility. So it's something that we've used throughout our program as well. And this is just a picture of how we've integrated the acceptance and commitment therapy into our Empower program. So this shows the 12 weeks of the program, and each week has a theme around the ACT or acceptance and commitment therapy topics that we've chosen. These have all been things that our previous patient partners have prioritized, so things like sleep, pacing, keeping it going at the end of the study, and managing thoughts and values. So I've explained to you what mind-body wellness is, what different techniques we've included in our program. Now I'll just give you a quick little history lesson of our research lab and how we started and how we got to where we are now with this Empower program. So we started at step 1 around 2021, and as I mentioned, Dr. Tannen is self-proclaimed obsessed with wellness, so a couple of her patients had said, you know, we're really interested in integrating these techniques that you've used in your daily life into the care that we received. So she worked with them, and they were all living with inflammatory bowel disease at the time, to develop an online program that included these breathwork and meditation techniques. And after that study, we also chatted with them. So we did some qualitative interviews because the surveys only tell us so much. And we got to understand what their overall experience was being in this program. And then they also gave us feedback so we could refine and enhance the program for future studies. And then that led us to being approached by the Canadian Primary Biliary Cholangitis Society, who said, hey, we want this for our people. So we worked with them to adapt the program to the PBC audience, and that also involved adding some behavior change techniques as well. And we did a smaller trial with them, and then a larger trial with about 87 people that I'll share some findings with you, and did some interviews with them in follow-up. And then that led us to step 6, which is the Empower program, which was what I'm kind of sharing with you today after we received a grant from the Canadian Institutes of Health Research. And we launched the Empower trial, and then later on in our trial, we were approached by Joanne and Mary and Ricky, who said, hey, we want this for our people. So we worked to adapt the program to meet the needs for PSC and are really excited about future steps and where we're going with this program. So these are some findings from our inflammatory bowel disease study. So we had just over 100 people, mean age of 42 years, and there was an even split between those with ulcerative colitis versus those with Crohn's. And what we found was that those who were exposed to the program had markedly reduced depression, anxiety, and stress symptoms compared to those who did not have access to the program. And then this is a busy slide, but just our results from the PBC randomized trial that we did. We noted that there were significant reductions in depression symptoms, as well as domains of quality of life, including emotional and social well-being. We didn't notice a change in fatigue until we looked at those who actually did the program more often. So we analyzed those who did the program 90 minutes or more each week, and we found that they actually had reduced fatigue, reduced anxiety, and reduced depression symptoms in that group. And I mentioned we also did qualitative interviews with them, and they talked about taking different parts of the program that they now find themselves using in their daily life. So things like breath work, meditation, and pacing were important concepts to a lot of the participants in this program. So now I'll move into describing Empower. So we've gotten through all those 6 steps that's led us to the Empower program here. And with the Empower program, we were really interested if this program could work, not just in IBD and PBC, which we've used before, but could it work across a broader range of chronic health conditions? We were also interested whether personnel support had an impact. So in our previous studies, we provided everyone with a phone call check-in each week, see how things were going, get their feedback, and kind of work on some goal setting if that was important to them. So we were wondering if that had an important impact or if that's something we could take away for this version of the program. And then last, we wanted to know about a dose response. So we saw fatigue change when people did it more often. We were wondering if that held true with this broader group of people or if other symptoms were affected in the same way. So Empower was designed as what we call a 3-armed randomized trial, which just meant that if people joined, they would be randomized to one of 3 arms. Any arm, they would get the program. It's just a matter of when they would get it. So if they went into our control group, they'd get it after 12 weeks. Or we had one of 2 intervention groups that started right away. And they differed in the level of personnel support, where intervention group 2 got those weekly phone call check-ins, and those were done with myself or other members of our research team. And I've shown you this slide before, so we included all of the components I've mentioned before with mind body wellness techniques, including mindful movement, breath work, meditation, and sleep practices. We actually offered 5 different levels of movement and then 3 different lengths, so people could choose from a 20-minute routine, a 30-minute routine, and then there were like 2 to 5 to 10-minute routines that they could choose from. So really flexible and a lot of options for people. Next, we had the psychology content. So I mentioned those 12 weeks of the program based on acceptance and commitment therapy with those different themes. And we also included some different games and activities to help reinforce some of those concepts. And then we had disease education. So I mentioned we had all those different programs, so IBD, PBC, PSC, and this is where they really differentiated from one another, was the education that was provided in this portion of the program. So the PSC program included more specific information about PSC, like what it is at a cellular level, what about the relationship between PSC and IBD. And then there were some general tips as well, such as like, how do I communicate with my healthcare provider? How do I share some new research I've done with them? And my personal favorite is this elevator pitch about how you can tell others about your condition without not giving too much away. And then lastly, we have the community support aspect. So it's kind of challenging to facilitate this in an online environment. But we use different things, so we gave people animal names so they were anonymous, but you'd come to recognize fellow participants and their names. You got points for things you're watching. Those gave you badges. We had a leaderboard. We're getting mixed feedback on our leaderboard. And then you were able to give people likes in the program, likes or kudos for things they're engaging in. And so Empower is unfortunately closed. We did close our trial. We had 825 people in total. A small subset of those were PSC because we started that later on, but we're really excited about the future with PSC. And then about 13% of our participants were post-transplant, and about 90% of those people were post-liver transplant. And then most of our participants were in the 55 to 65 age with a mean age of 56 years. And the majority were female or identified as women, and 43% actually lived outside of any urban locations, so rurally or remotely. And we had people across the world engage with this program. And we're using mixed methods, so what that means is we're just using different types of data collection to look at the impact of the program. So we're using surveys, so you may be familiar with some of these surveys if you've engaged with research before, but looking at anxiety and depression symptoms, things like frailty, fatigue, and sleep. And then we're also doing interviews with a subset of people. So we've actually completed 103 interviews and are just in the process of analyzing all of our data at this point. But we're really excited for the next steps. Dr. Tannen wanted me to mention that her and Dr. Yvonne, as well as a much larger group of people, have submitted a grant to develop a program specific to PSC and engage PBC as well, and look at the impact of this program with and without psychologist-led group sessions. We're very excited and are hopeful for this grant. And we're not stopping there. Our group has also submitted a grant for this CARE-L program, which is development of an Empower version of the program for caregivers of people caring for those living with chronic liver disease. And then we're actively working on this Empower mechanism study, which is really cool. It's 30 people in the Edmonton area, unfortunately, because you have to come in quite often. But we're giving them smartwatches, we're getting their lab values, and looking at body composition with imaging, and as well as some brain imaging, which is really cool, to see how their bodies change over time engaging with the program. Because surveys are great, but other people like objective and hard markers. So we're really excited to share those results with you soon. But thank you all so much.
Thank you so much, Emily, for that wonderful presentation. It's so nice to see some of this cutting-edge methodology being applied to the autoimmune and cholestatic. And it seems like there's great cooperation and collaboration coming for PSC. Thank you again. We will conclude the session with our last speaker, Joanne Hatchett, who's known to all of us, of course. She's the medical science liaison for PSC Partners, focusing on support and education for those impacted with PSC. Most recently, she was a family nurse practitioner, and just before accepting the position as PSC Partners, she was a member of our board of directors, and she is, as well, we all well know, a PSC caregiver. She'll be speaking about the role of PSC Partners and being there for you and in building community. Thank you so much.
Thank you. Good afternoon, good morning. It's my pleasure and passion to talk about PSC Partners, education and support during our first 20 years. We know from our mission statement, research, education, and support are intertwined and essential elements for everything we do, as you're all experiencing here now. The first conferences were amazing. I attended the 2006 conference just a few weeks after my son's diagnosis with PSC and ulcerative colitis. I arrived in Pittsburgh about 6 p.m., bedraggled, carrying a suitcase, and was greeted by Tim Hooley, one of the most wonderful persons you could ever meet, kind, caring individual. I felt so welcomed and left the conference 2 days later feeling supported, well-educated, and thanks to the excellent speakers, and most importantly, like I'd met my second family. Attending the conference was one of the best decisions I've made. We are so glad you found us, and we're here together. For those of you who were present at the first few conferences, the primary focus was education. So far, we've had more than 5,000 people attending the annual conferences. In addition to education, the most amazing benefit is being with others who understand what living with this disease is like, the uncertainty, the number and variability of symptoms, and the life-changing effects on those living with PSC and their families. PSC Partners is committed to providing everyone affected by PSC with education, with over 600 presentations at conferences, many of which are on our website, and the monthly newsletter and the website are both special things that have begun since then. I do want to mention the monthly newsletter was begun by Pat Bandy, which was a huge undertaking, and she did a beautiful job with that. Over the years, some people hosted small group meetings also, and some of the researchers have begun having their own PSC educational meetings, which is great. Thank you all for your support. I want to focus on 2009, when PSC Partners, led by Sandy Perlman, launched the PSC Partners Facebook group. Right now, that feels like that was a normal thing in today's world, that we have social media, but for PSC patients, This expanded their ability to connect, to share stories, and support each other. This Facebook group brought together patients and families from around the world, leading to connections, friendships, sharing of experiences, and most importantly, not feeling alone. The Mentor-Mentee program was initiated to support newcomers to the annual conferences. This program has expanded to a year-round program and is led by volunteer Trish Stolfus to support everyone affected by PSC, including the newly diagnosed, those with new or increasing symptoms or challenges, those awaiting transplant, or if someone really just wants to talk to another PSCer or caregiver. This program has fostered bonds, often leading to years of friendships between a mentor and their mentee. I'd like to thank everyone who has been a mentor and to those who support others on Facebook. Your work is so appreciated. An incredible and perhaps not well-known accomplishment are the 15 PSC Partners publications.
You're on the wrong slide. Just on Facebook.
Oh, thank you very much. Okay. All right. I'm on Facebook, and I forgot the Mentor-Mentee. Good heavens. We are now on the registry. Yay! All right. An incredible and perhaps not well-known accomplishment are the 15 PSC Partners publications, which have been published since 2015, which are from the PSC Partners registry data. Your participation and insights are making a difference to the body of knowledge surrounding PSC through research surveys, studies, focus groups, and clinical trials. This information is available to everyone by visiting the registry site, News and Resources Registry Impact page. 15 publications, quite amazing. Please visit the registry booth. Another pivotal event for PSC Partners was the initiation of the PSC Forum, led by Dr. Veronica Miller, bringing together researchers, patients, clinicians, industry experts, and FDA to build collaborations and projects such as the Acute Cholangitis Project. How many of you have participated in or watched the externally led Patient-Focused Drug Development Forum, where PSC Partners worked with FDA to hear the stories of patients and caregivers and learn how PSC impacts their lives? This interactive, virtual public meeting encouraged those affected by PSC to share the impact of their symptoms, how their symptoms impacted their quality of life, their ability to function. They talked about their uncertainties about the future and why new treatments are so desperately needed. To help us understand the experience of those with PSC, we developed the Our Voices survey, completed by 819 individuals with PSC or their patients, their parents. The survey further highlighted the severity of PSC symptoms. The PFDD meeting and Our Voices survey helped build our patient advocacy efforts and foster new relationships in hopes of finding treatments and a cure for PSC. As Ricky mentioned yesterday, the Chan Zuckerberg Rare as One grant has promoted resources and knowledge acquisition, which has expanded the reach of PSC Partners and initiated collaborations with other rare disease groups. The 2022 CZI Patient-Partnered Collaborative Grant with the University of Toronto includes Mary Vyas as the patient primary investigator and Dr. Sonia McParland as the research primary investigator for this collaborative pediatric 4-year single-cell study. Under the guidance of Dr. Donna Yvonne and Dr. Bryce Reeve, the Symptom Assessment Project was formally begun in 2022 to further identify and recognize the many symptoms experienced by those with PSC. A 2020 webinar focused on describing how PSC symptoms affected individuals. This information led to the Symptom Assessment Project to develop PSC-specific tools for clinical trials. There have been 2 focus groups and were followed by detailed one-on-one interviews to discover how fatigue, brain fog, and liver pain affect PSCers. The goal is to develop 3 regulatory-approved PSC symptom assessment tools. Fatigue and brain fog, those tools are nearly complete. How else can PSC voices reach others? Our advocacy and openness to inform others about PSC is vital. Over the last 4 years, the annual Walk K83.01 fundraiser has empowered many individuals associated with PSC to invite others to walk, talk, to swim, to donate to PSC partners, raising over $500,000 for PSC research. Thank you, Hallie Halloran, for creating and fostering this fun, valuable fundraiser, which also raises awareness for education about PSC. The PSC Partners Health Equity Group has been working for the last 2 years to bring support and education to everyone with PSC. We know there are many people with PSC who do not have the support and education they need and deserve. In 2022, we began working with the Health Equity Working Group and Patient Advisory Group under the guidance of Dr. Kadis Imam. We are working to find and build relationships with those who don't have access to PSC partners. We have also done 3 webinars, which are on the PSC website. This group has also developed PSC Partners Health Equity Survey, an important outreach tool, which we hope everyone with PSC will complete. Please visit the registry booth and talk to them about how you can take the Health Equity Survey. What does this survey do? It helps us better define not only the medical history of individuals, but also create understanding of how PSC affects your ability to go to school, to work, to obtain health insurance, medications, and more. Last year, we had the PSC community space in the conference. This is a great experience, and it's here today, just around the corner to the right of all of the booths. This experience is where you can answer insightful questions about PSC from a patient, caregiver, or provider focus. We encourage everyone to read the responses that others have written, write your own responses, and to talk to each other. I have to say, it's really heartwarming and just meaningful to visit that community space during your breaks. I want to tell you, our health equity work is only just beginning. The conferences have expanded to include what you're experiencing, focusing on research, education, peer support, and fun. What makes the annual conferences extra special is the dedication and support provided by our amazing volunteers. Over 2,000 people have volunteered at conferences, which does not include this year's volunteers. Thank you all. COVID led us to an 18-month series of webinars with researchers from the US and Canada. The webinar series was designed to bring the voice of the patient to the forefront, to encourage and support everyone affected by PSC to ask questions. In 2022, the strategic research plan was initiated based on interviews by Dr. Ruth Ann Pye and Dr. Jessica Kirkpatrick, with feedback from researchers from North America, Europe, and the UK. The 2022 virtual annual meeting brought together the inaugural International Collaborative Research Network, ICRN, a think tank with 20 small group sessions comprised of expert researchers, community moderators, individuals affected by PSC, all to discuss PSC research, questions, and issues identified both by the community and the researchers. This led to the initial PSC Research Initiative, which continues to evolve and develop. We've only begun and plan to move forward faster as we participate in research, advocacy, and outreach, and building new bonds for fellow PSCers, family, and friends. PSC Partners is here for everyone, those we know and those who have not yet found us. We want everyone's voices to be heard. And I'd like to end with a quote from Sandy Perlman. We want everyone to have the support and education to thrive while living with PSC. Thank you.
Thank you so much, Joanne, for that inspirational overview of 20 years of progress. It's just amazing to think about all the programs that have affected so many lives. Thank you all. We have the opportunity for people to ask questions and write them on index cards that are being collected and brought to the front. While the first ones come up, I have a question for Emily. Thank you so much for wonderful discussion. I have a question just regarding the interplay between online and individualized techniques and also versus community. I know you talked about not the tension between those two, but how to address both at the same time. To what degree do you think community can be brought together using those techniques, especially among rare diseases where it's unlikely that patients will naturally run into others with the disease?
Yeah, that's a great question, and something we struggled with. You know, the online delivery has so many benefits. You can reach a broader group of people. You can upload a lot of content, but the challenge is people want that community, and it's something we've run into with PBC as well as these rare disease networks. They really want that community, and so what we've tried to do is facilitate a little community through the Zoom online sessions, and we've had discussions around discussion forums and talks with some of our patient partners who've kind of advocated for discussion forums. Some feel they're not as beneficial. So it's really the chatting and conversations with patients that's kind of guided us towards making an online Zoom session that community piece, but something we're still exploring. So if anyone here has any feedback or ideas for the future version of the PSC program about how we can facilitate that community, that would be very, very helpful.
Thank you. Thank you very much. There is a question here about, has anyone found a drug that successfully quells itching? That's certainly a very pertinent question. I guess I can just give a bit of an insight into that. There are incompletely effective medications for itching of PSC to date. There are some drugs, I think, which were discussed yesterday, which are going to be studied that might be effective, such as the IBAT inhibitors, and furthermore, the PPAR agonists, the category of drugs approved now as second-line agents for PBC, which are going to be studied in PSC, will hopefully be effective. But there is no doubt that the itching of PSC, which can become very problematic, has a huge impact on quality of life and challenges us with all sorts of needs to address from a qualitative perspective as well. I have a question for Sara. Sara, so what an absolutely fantastic talk. Thank you so much. Have you experienced or have you noticed any ways to bring those techniques and those teaching to patients at the times when there is not a crisis that can then be utilized during periods of crisis? I think we're all, as humans, more attuned to what we need to address situations when there's a flare or a crisis, but oftentimes these are unpredictable in PSC. And so I'm just wondering how you often counsel patients in that regard.
Yeah, I think one of the things is a lot of the skills that we look at and we've broken down. I've actually looked at what's the driver in like this idea of like resilience, like what is resilience and how is it connected to quality of life? And I can say certainly in the research I've done in IBD, the two things that tend to come out are optimism and mindfulness. And I think part of that is also around, so I am what folks would call like an ACT therapist, which is acceptance and commitment therapy. So I also often recommend that for anyone living with chronic disease. I will put an asterisk around the word acceptance because I think it's really misleading. It's really hard to talk about the idea of acceptance and not hear resignation, and that's not what it is. It's more of a willingness to work with. So I think that's kind of a roundabout way to kind of answer your question. If I were to think about what can people do, even when things are going fairly well, is whether that's anything around optimism and connecting with what's going right. We're working with that negativity bias of our brain that's going to automatically zoom in on what's going wrong. whether that's noticing every day 3 things that went right or you did well with, or whether that's doing some mindfulness training, or whether that's that idea of, this is a really specific recommendation, but anytime you have the urge to say the word but, let's swap that out for an and. Because no matter what beautiful, positive, resilient things you say, if you add a but in there, you have completely disregarded it all, and all your focus is on the negatives and what's going wrong. That's what I'd say.
Thank you very much. Another question for Emily here. How do I get in touch with Empower? They want to sign up.
No, that's great. We'd love to have you. I have a sign-up sheet. You can also email me or just come chat with me, and we can get you connected with the program. And we'd also love to hear from you about developing this new version of the program. So come find me, and we'll get you connected.
Thank you very much. Question for Joanne. This is a good one. How may I serve?
How may I serve?
Yes.
There are many ways of how you serve. You serve through talking to your physicians and other medical professionals about how you feel and letting them know, asking them questions. You serve as you walk around wearing your PSC shirts to the grocery store, etc., and being there talking about PSC awareness. Going back to fundraising, and Sandy Proman years ago talked about just putting your change in a jar and sending it in. Small, large donations all make a difference. The support you all give to each other. We have lots of volunteer activities, for example, at the conference. Many people, by attending our peer group virtual meetings, what we call Zoom rooms, your presence there makes a difference to the new folks who come, and we have lots and lots of new people that are attending Zoom rooms. So it's very exciting. So your participation there, and when you feel in the mood or are interested in helping to facilitate or co-facilitate those groups. So lots of things on your evaluation for the conference. It asks, well, how can I volunteer? How can I help? Please write down those answers. Ricky, do you want to add anything?
That's perfect. Join the registry.
Oh, how could I forget the registry? Join the registry. How did I forget that? Oh, I was going to ask you to ask 2 questions.
Sure.
Okay, ask Sara this one first.
Okay. Question for Sara.
Okay.
Could you ask Sara to talk about the question, caregivers always ask, how are you?
I have to, caregivers ask, how are you? And and the question is what to say?
Yeah.
What the caregivers say?
You can answer from a caregiver perspective or a parent perspective or a patient perspective. And I'll say why I'm reminding her of this. Is she's going, what is Joanne talking about? At the Canadian conference a few months ago, you had talked about when my normal response when I see my son.
the good you.
How are you?
Oh, and then it's the automatic, I call it the good you, where everyone just automatically, people are not actually connecting, and when they say like, how are you, it's not mindful at all. It's the automatic, like, how are you? Good, you? Like, nobody actually wants to know, and I think, I think to answer the question of, okay, so what do you say to people and how you say it? I think ultimately it has everything to do with where you're at, whether you are living with PSC or get to love someone who has PSC. Where are you at in that moment? What's your capacity? Like, because I think there's an opportunity there for some honesty, if that's where you want to go, and an opportunity for advocacy. I also do allow people the permission to. Sometimes we just got to go with the good you. Sometimes that's part of it as well. Is that where you were going with it, Joanne? Is that what came out of my mouth then? Yeah, I think it's more the invitation to think about those everyday moments. And when I said, you know, not everyone has time to meditate, it's those moments where you could level up an everyday activity you're doing anyway. So when someone says, how are you? take a minute and just kind of, I promise you have time for a breath and to consider how actually are you in that moment. Whether you share that with that person or not, it's that invitation to actually check in.
Thank you.
Yeah.
Another question, this is for Emily, which is, do you have any comments or any anecdotes as to what the people who've participated in Empower share and say about the programs thus far?
Yeah, I did. We have some quotes. I had a video, but I cut it because I was talking too much. But it goes over the positive impacts, and it ranges so differently for people. Some people gravitate towards like meditation or breathing. It wasn't something they tried before. It's a helpful tool that they can now use in daily stressful situations. Others, it's the education that they get from the program. Maybe they were newly diagnosed with PBC, and then they've done the program and gained that knowledge and then that community from the program. And others, it's around that acceptance and commitment therapy where things like pacing have been really valuable for people. And I shared that in my breakout room yesterday, and we talked about pacing, and some people hadn't heard about it before, but it's this idea of not giving it all on a good day so that you can just keep yourself in these steady oscillations. So there's different things that people pull from the program that seem to have an impact, ranging from the techniques, the education, or the psychology content. So I think that's the beauty of a program like this, is there's different things for people to grab hold of. And I'm happy to share some of our interview work and our videos with anyone who's interested.
Perfect. Thank you. You know what? These questions just keep getting better and better. So here's the one for Sara, which is, how can we encourage mental health support to be included in chronic liver disease treatment, guidance, and in care?
Oh, I wish I had like a great answer. I think there's so much advocacy going on, and I think, I actually think I'm from Canada, and I think in the States you guys actually have it kind of figured out a bit better than we do, in a lot of ways, where I think it's about just advocating and letting the teams know that this is something that you would be interested in, because there's a certain level of, if it doesn't come up and it's not put out in front of people's faces, the general assumption is that everything's fine. They are fine to just tough it out. I think there's a lot of, the other thing I want to bring up, which is adjacent to this, and something that I see that happens in healthcare a lot, is this idea of kind of like that good patient or the resilient family, where they're like, oh my gosh, you're so great, you're handling this so well. And I just want to encourage everyone that can, to me, sometimes feel like a lot of pressure. And that feels like a lot of pressure to continue to be resilient and not complain and be the kind of good patient. So the invitation is to be just wildly honest with your teams if you are struggling, or if it's something that you want to do even from a perspective of resilience. Say, hey, this is just a lot to navigate, and let them know and ask them to help navigate. And in that way, the more you ask, they'll see more of the demand.
Thank you. Thank you very much. This one is for Joanne. What's the origin of the PSC Partners logo?
The origin of the logo, do you know? I'm not sure I know the exact answer.
I think we had a contest, actually, we had an online contest, and that's the one that won. Yeah, that is what happened.
An online contest where people submitted ideas for the logo. And how did you choose the puzzles? Did everybody hear? I don't remember. I love the puzzles.
Don's bow tie, that's where it came from.
Oh, Don's bow tie. Actually, I would share, I've had this thought many, many times. When people talk about PSC as the black box of liver disease, and you see these puzzles, how did you ever know that you have the perfect, we have to put the pieces of the puzzle together.
Yeah, I always thought it was the puzzle pieces were like the clinical work, the research, and the community. So, mission accomplished.
There you go. Another question for Sara. This is a good one, which is, can denial ever be considered a functional approach to deal with all of this?
So to be honest, I think about whether it's working for you or not. And I think there are some contexts where denial might be working for you. It's just a matter of being really honest about whether that is actually working. Because I think it's that, again, I really want to encourage people to not think about like right, wrong, good, bad. And I think denial in short spurts can be really supportive because it might help you rally to do something really meaningful, or it might help. Do I think denial all the way through? At some point, I think it doesn't become so workable anymore, but I think that's the part of it.
Thank you. Thank you. I agree. Question for Emily, thank you. This is a good one, which is, what is a good elevator pitch for talking about or describing your PSC? And I know that you're getting into this specific area of research, but just any tips or thoughts on to how people might develop their own elevator pitch to describe their disease?
Oh, that's a good question. I wish I refreshed myself and watched the video. But it is in our program. If you do our program, I can show you that video. But I think it's just kind of having your own kind of short statement. And it kind of goes along with the how are you good, you know? Because you're dealing with a lot. You may not want to get into details, but it's just like, I've got this condition. I'm feeling good today. Thank you for your concern, and kind of leaving it at that. So just a short and sweet little note for people who may not need to know every detail. So, yeah.
Yeah. I'll just say that whenever you come up with that, the other thing to do is to make it so rote and to repeat it so often that in times of stress or when you're not feeling well, it just rolls out of your mouth. So whatever that short statement, couple words pitch is, really and truly, as weird as it sounds, walk around your house or sit and say it over and over and over again.
Okay, question for Sara. A lot of people are afraid to share with their doctors because of needing approval for transplant. I feel we need doctors to normalize this and that it will not harm you down the road. Obviously, from a physician standpoint, this is important because trust and communication is vital, but in your experiences with coping and handling illness, how to approach the relationship and the sharing with the other medical providers or the team in general.
Just in terms of how honest to be about symptoms and stuff like that. I think part of it is building that relationship over time. And being as honest as you can with whoever you can, because most of the teams do have multiple people, and part of it is building that trust that it's something that you want to handle as a team or as early on as possible, is what I would say ultimately. And if there are concerns with how honest you can be with the team, talk about it, right? I know that can feel really, really scary, but the avoidance is just going to make the problem bigger and bigger and bigger and bigger and make it that much more difficult to say what you need to say down the road.
Thank you. Last question for Emily. Tips for helping people get to sleep. PSC patients often are awake at night and can't stay awake during the day. Clearly there's some disease component, but in your studies and evaluations of sleeping techniques, would you give any general advice or any particular advice?
Yeah, that's something we heard in our breakout session, like whether it's just overall sleep challenges or related to itch, or even fatigue with napping throughout the day. It's something that comes up a lot. And in our program, we've developed some specific sleep meditations to help kind of move the body towards relaxation right before bed. So there are different techniques we use with more active meditations versus more relaxing meditations. So those can be helpful. And routine, we've heard, has been really, really helpful. So if you have this typical bed routine, you're going to watch your show, you're going to read a book, whatever, and go to bed at the same time every night and try to wake up. That's easier said than done. But those are some of the tips that our team has found to be helpful for people.
Thank you. Just to wrap up then, someone asked if stress hormones can spike pruritus or itching. That's an interesting question. I don't know myself how much that could be playing a role. We know that autoimmune disease and cholestasis can sometimes become more active with stress. That's an interesting topic itself. Whether that influences pruritus, I'm not entirely sure, but I think it's plausible. And lastly here, somebody highly recommends playing Pokemon Go. Now, I'm not sure if this is when you're insomniac or to help with mindfulness, but I'll let each individual person decide what's the best time, but it probably is good for well-being and mental health. So with that, thank you so much for your presence here, and thank you for the speakers.
So thank you all, including David. We really appreciate this. I have a couple reminders for you. The PSC annual conference photo will be immediately after this. So please go straight as fast as you can to the grand staircase, and I believe people will be out there directing you to that. Following the group photo, you'll have your peer lunch with medical professionals. A medical professional may sit at your table, and this is just to have a nice conversation during lunch. I do want to make sure that the lunch tables, they'll be on that Paseo Road with the palm trees. There are several tables that will have canopies over them, umbrellas. Those are specifically for people who truly, either due to medications or their autoimmune condition, need to have the sun protection. Following that, we will have the fun, interesting Ask the Experts questions, sessions. That'll begin right at 2:20. You don't want to miss those. They're going to be really interesting for you. And general session 3 will begin on time at 3:35 so that we have plenty of time for rest time afterwards. Thank you all.